Hello, this is Dr. Lawrence Janowski, Medical Director for Sonata Aesthetics in Broomfield, Colorado. I've been an aesthetic physician for over 18 years, and in that time, I've honed various techniques to help patients overcome one of their greatest fears, a painful injection experience. I had a patient say to me the other day as I was injecting her, "Dr. J, I hardly feel anything that you're doing. You're like a ninja." And I thought to myself, wow, that's a really nice compliment. To be able to deliver painless or nearly painless injections is an art that I've perfected over many years. And now I'd like to share some of my techniques, tips, and tricks with you, courtesy of the Injection Ninja. Hi, it's Dr. Janowski, the Injection Ninja, giving you tips on how to keep your patients comfortable during injection procedures. We're going to demonstrate the dental block today. Dental blocks are a very valuable tool that you should have in your toolbox if you don't already. They're very easy to do, they're very safe, and patients really appreciate it. The most common scenario where I will do a dental block is for vertical lip lines. This hurts even more than the lip itself. Often with lip injections we can get away with simply using cream, but with the lip lines it's not the same. So I'm going to demonstrate how I do the dental block. And what I like to do is I like to use a 1 cc insulin syringe. It's just the right size needle for the dental block. We can have these prepped ahead of time. I like to use 2% lidocaine with epi. 1% is typically sufficient. I find people are a little more comfortable with the 2%. You can use the 1 cc for the top, and you can do 1 cc for the bottom. Or you can often get away with half for the top and half for the bottom. And I'll demonstrate both top and bottom today. So before I do any dental block, I always pre-numb the patient. I use Hurricane topical, and we're just going to place that in the vestibule. So we'll just simply use a Q-tip to start getting that stuff to work so that the injection itself is less uncomfortable. And so we'll just place that in here and a little bit down here. So the patient can keep their mouth closed. They don't need to really do anything. You want to take a 4x4 and hold the lip out till you can see the reflection of the gum line here. It's called the vestibule. And you're just going to inject maybe 3 or 4 points here. I've already put the Hurricane in, so she's pre-numbed. And then we're just going to go right down into that little reflection, and we can do a little shaking as we inject a little of that product. Again, you can inject anterograde and go a little deeper as you go. And right up towards the midline, that's an important one. We want to get some in there as well, like this. And we're shaking. Same thing on this side. We're just going to go across. I'm going to turn you a little bit right up into this spot here. And then push forward as you inject a little bit. So typically 3 on each side. Then I like to put one right here because the nerves do come down toward the lip in that direction. So right here and here. The bottom is the same thing. What I've done is I'm over the patient. My left arm is all the way around the patient's head and holding the lip on the opposite side. So we're going to inject the opposite side. And so again, we're just going to inject anterograde 3 or 4 points right along that gum line. Open. Okay, now we're on the other side, which is a lot easier to inject. And we'll go to the opposite side here, and we'll take a little bit and inject going forward all the way out to the side. It's not necessary to go very deep. That's why I use these needles. We're really just trying to get the nerves that feed the lip. I'm wearing a set of loops. You don't have to use loops to do this. I just find it helpful because I have the light and the magnification. And then patient will be numb within a few seconds. Okay, so in conclusion, the dental block can turn an otherwise very uncomfortable procedure, particularly vertical rhytids of the upper lip, into essentially a painless procedure, and it really does become painless at that point. So it's really a nice tool to have if you're not doing dental blocks. As I just demonstrated, they're very easy to do. You just take a few minutes, and the patient will really appreciate it. So this is Dr. Janowski, the Injection Ninja, giving you tips on how to have happier patients, less pain, and less bruising. Good luck.